Welcome to Pre-Primary Sources. I'm Liz Nolasco, and I have with me today Dr. B. Dr. B, I'm going to ask you to introduce yourself, please.
Yeah, thanks for having me, Liz. I am B, please. I am a doctoral recipient of a sociology degree, but like to go by B. Thanks.
Thank you. And so I'm talking today about the institution of science, right? Because we think of it as this agnostic force, this equalizer, but we also know that historically and presently that is not the case. And so I think where I wanted to start, right, was where are those gatekeepers, right? Who is holding these keys for whose voices are heard and who's overlooked, whether intentionally or not?
Yeah, so I think that it's important to always contextualize who is able to produce science when we talk about these powers and balances, right? And science perhaps as a vehicle or a tool to either empower or marginalize. So historically, science production has been centered around people that have the power to produce education and knowledge. And then it's not only the production of it, but it's also the ability to like disseminate it, to send it out. So thanks, Liz, for doing this, because I think some of this stuff's super important. So I think that's something to kind of start off the conversation and keep in mind, that it could be both. So oftentimes, when we begin to think of research as empowering and marginalizing, um, it's important to bring forward to the table, well, who is actually producing the science? What is the intention? And what are we doing with it? And when I say that is how is it going to be used, right? Um, but both the empowering part and the marginalizing part can happen at any stage, if you would, if you want to think of this as a process. It could happen at any way, shape, or form. I also think that it's important to remember that only a privileged few historically have been able to attain educational levels that allow them to contribute to science production. And so the academy or science, the institution of science production, sits within that historical context. And so oftentimes we want to depart from our historical roots, but it's nearly impossible. So we have to recognize our roots. And sometimes when I'm in the classroom, I explain this to students in this way. I say, um, oftentimes growing up, there's certain habits and things that you do, and that your family taught you. And then as a young adult, you begin to realize, like, why do I even do that? And you begin to ask yourself, how do I do that? Or why do I do that? And we begin to shed our historical roots. And so we let go of the things that we don't want. I always tell students, I ate carrots up until I was 25 years old. I don't like carrots, but I was told carrots were good for me. It's an easy vegetable to introduce children into foods. Loved carrots until one day I was like, man, I really don't like carrots. And I had to ask myself, why am I eating them? Right. And so I use that in the college classroom, but I use it because it's important almost in any classroom to recognize that the way our history as educators is rooted in a history of privilege. It was built for people of a certain look, of a certain socioeconomic status, typically during, well, historically, to colonize, right? To be able to colonize and oppress peoples. That's our history. But just because that's our history, like the carrots, I don't think you have
No.
to continue to consume that, right? And science, I think it's important to kind of, it's important to think of, oh, did I get you back?
I can hear you now, but can you repeat from what you were saying? Because just because it's our history, like the carrots.
Yeah,
Thank
yeah,
you.
yeah. You're welcome. Yeah, I figured we were gonna do some editing. So just because that is those are our historical roots as educators or science producers, it doesn't mean that we need to continue the cycle of reproducing our science in the same way, right? And so I think in that way, that's when science can actually be marginalizing, when we repeat um the things that we were taught without being thoughtful about the decisions we are making when we're conducting science, I think that's really, really important. So, like I said, very similar to when I ate carrots. Why am I eating carrots? It's that simple as a scientist. It's actually not that complicated to begin to ask yourself, why am I doing this? And is there a different way to do it? Sometimes that different way, it could be a better way, a way that allows us to empower other groups of people or people that have been silenced historically, because that's part of our history as an institution of science production, right? And so how do we then use the power to produce science to basically empower people? I think it's really important. Um,
Yeah, and
so
I think there's this recent movement or recent publicization, right? When you're looking particularly at federal funding in this year of 2025, there's this idea that looking towards empowering additional voices is a stab at equity, right? We're not getting the best people, we're getting quotas. And I'm I would love to hear your thoughts there, right? Because there is such a powerful history of limiting who can participate. This idea of weaponizing the word equity is so odious to me, and I'd like to hear your thoughts.
yeah, I echo your sentiment. I think it comes from two. So I think it comes from many places, but I think when I'm thoughtful about some of those narratives that come out, that by 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 paying attention to demographics, by paying attention to who's not at the table, we are then eliminating other people at the table, right? That's a complex, it's a complex system, but I think that being thoughtful about our historical roots to then acknowledge who's at the table in a very similar fashion and way is going to be important. Just because we pay attention to the things that we could do better, it doesn't mean that the things that we have already done good and have done good per se need are diminished. There's also a way to talk about groups of people without actually and elevating groups of people without having to put other people down. And this happens oftentimes in these narratives, right? It happens that, well, if we talk about equity is the dirty word. First off, I have to be the address the elephant in the room that nobody wants to talk about.
Tell me more. Yes, love this.
Yeah, equity is the dirty word. And it's dirty because somebody has the power to make it so. Until we recognize that somebody or somebody's has the power to make it so, it remains dirty. And words are powerful, right? Equity is a word to uplift peoples, to recognize the harm we have done to communities as a country, because we could talk cultural level here as a country of the United States, or we can go global. Our damage crosses seas, it goes overseas. We have caused global damages. And in order to equalize, equity is important to make it better, to really uplift people and say, hey, you matter. It, it's important that we recognize when we have initially told people they didn't matter, right? But I think it's really hard. It's really hard for us to accept that in order to make equity not a dirty word, it, we have to sit with the ugliness of who and how we have marginalized people. And sometimes people say, we can't do both. The minute that you use equity, you're leaving people behind. But it doesn't have to be that way. And I think instead of talking to each other, sometimes we talk through each other, right? Because we all want to have value, understandable, as we are all valuable. But I think that it sits in the same, to tie it back to that kind of question of like science, the institution of science. Science is an institution that is in charge of social progression through building science. That's the purpose of the institution of science. We create science, innovation. We embrace technology. We embrace change. But the minute that science marries equity, or we're trying to create a relationship between the both, somehow that becomes dirty and not science, if you would. Because now we're trying to do something else, equity, not science, but science is equitable. I mean, science has been used to actually make change, to make this world a better place. And then we're changing outcomes and social conditions for people that have been neglected and groups that have been ignored. How can that not be science in itself, right? So I think I don't know, it starts with that. You just have to
Yeah.
embrace equity as like not the dirty word and charge forward, right? And then allowing science and equity to have a dialogue, not to compete. And I think sometimes we put them at opposite ends.
Right, right, when they coexist. So I'm curious, when you're reading research, right, and obviously you've conducted your own research, with this in mind, this idea of conducting science having the power to continue marginalizing or uplifting voices, what are you looking at if you're, doing a literature review for a project and you're looking at something and trying to make sure you're getting appropriately representative data? What are you looking for when you're reading that tells you like, oh, this was done in conjunction with the communities that I'm looking at, or this applies to the communities that I'm looking at?
Yeah, that's really important. I have an example, I think that from something that I did very recently. So when scholars like myself, so because we like labels, in the institution of science, we are called critical scholars. And I want to take the time to kind of insert the power of words. I'm not a critical scholar. I am a radical scholar seeking radical changes. And that is so important, and words are important because critical means I'm going to criticize what you did, but I can both be critical of your work and seek radical change at the same time. Doesn't have to be either or, right? So I'm a radical scholar seeking radical change. And so just kind of like if you were looking in your junk drawer and only you know what you're looking for. As a scientist, I think I can be easily distracted into whatever database that I'm going to go seeking. And it's all this junk, right? Because when science can look junky and I'm digging out. And so anytime I dig an article that is of interest to me, I pay attention about the methodology. That's the first thing I go to. A lot of people go to the results and sometimes they don't even read the methods, right? And I
Mhm.
will challenge anybody using science to look at the method because that tells you how the information was produced. Also, look at who produced the knowledge. And I don't mean just the individual, but who funded that person. And it's really hard work, you know um, when you're in that junk drawer, Google Scholar, or whatever it is whatever system you're using, it's really hard work because you have to be so intentional, right? But changing requires intention, and changing bad behaviors or histories requires work. And so I think the sort of things that I start with the method. What did you do? Right. And then I say, who did it? Because if your method is good, if what you did is addressing bias of the researcher, bias of the site, then I am less interested in knowing who produced it other than to elevate their work. I just want to make sure that then your method is sound and that that methodological bias has been reduced so then I can go look you up. And then your name becomes maybe less relevant if your methodology is good. Sometimes I'll do backwards, right? A lot of my work looks at the health patterns of LGBTQ people and so that's really important because among the groups that have been marginalized in science, it are LGBTQ communities. And so I'm always in the search of what we would otherwise sometimes label as queer scholars, people from those communities that have helped produce that knowledge. They're out there. It may be harder to find their work because they exist in a different environment, even when it comes to science production, which we'll talk about at a different time, but that means that you have to be very intentional, right? And so a recent piece of work that I read was about indigenous knowledge and how indigenous groups of people pass on um, traditions and knowledge of queer folk within actually like Sonora, Mexico. And this group of indigenous people, as they self-label in that article as indigenous, they basically say we don't read and write, so we talk our oral history. And so the person said, I don't have a method other than I walk with my grandfather to collect the data. And that is how I collected my data orally from my abuelo, from my grandpa, and uplifts not only the grandfather for being able to produce knowledge, but uplifts an entire community. And that is equity. That's equitable, right? Just because we uplifted this remote group of people in Mexico, or because they're so remote and removed, you know, from our science of production doesn't mean they can't be brought in. But it took a queer scholar from that place to bring that knowledge in.
Right. And that idea of there are so many valuable ways of maintaining and reproducing knowledge. And institutionally, we haven't seen that enough. We haven't honored that.
No, I think it's hard, and I'm embarrassed because I'm a quantitative researcher, right? And we also rely on numbers a lot more than we do on the story, right? This is an
Mhm.
oral history. This is why I thought it was interesting. Sometimes when I see good articles, I keep them, I file them away, and I find a way to invoke them into my work. I find a way to knit them in because it's my way of seeking change. It's my way of elevating them. I may not be able to, cross borders to speak to every scholar and not just like physical borders, but I mean communal borders, right? Because some of the spaces are also only for the community because they're worried and scared of what we may do with what happens in communities as well, right? And so I think it's just it's a way for me personally to kind of go seek, the work of people that have been silenced. Um, and the story is important. And there's a way to combine the story and data, right? So kind of what you said, like we don't see that data. Again, that type of data that highlights inequalities, data that highlights injustice, data that points out problems that are not discussed openly because then they uproot our histories. We scare of that data.
Mhm.
And I think we just, instead of being brave and courageous and responding to the lack of the data, we scare of it. I think it's scary to feel, especially as a scientist, it's scary to feel like you're not making a change. It,
Right.
it's scary to realize that you don't have what you need to make a change. It's really scary be like, wow, I wanted to. So now that I know that, what do I do with it? is really scary, you know. I the secret's unveiled. You have nobody to tell, and now you harbor the secret. I think it's really hard for scientists. I think most of us sign up to be scientists to really be innovative, change, and advance society. And then when we uncover the problems in our own institution of science, it's really hard to reckon with that, I think, as a scholar.
Yeah, that makes perfect sense. I wonder how that sits with your orientation as a radical scholar, right? That frustration that you kind of describe running up against and wanting to make change and still needing more. I don't even know exactly what I'm asking. I hope you kind of forget what I'm asking.
No, I understand. Um, it's hard work. I think also, I think this is why I said I'm a radical scholar, not a critical scholar, because I don't want to be seen as somebody that is critical just for the sake of being critical and saying this is wrong, this is wrong, this is wrong, right? I'm on the other end. Maybe I'm just too old that I realized, wow, we really screwed up. Can we fix it? You know, sheepishly coming to the table, can I fix it? And I don't even know. Sometimes I feel like I can, sometimes I don't. I had a recent publication being rejected. It was about trans access to primary care providers for transgender individuals. And I got it back from a scientific journal editor, and they said, this is too political. It doesn't belong in science. Um, so
Right.
yeah, so I
Sorry.
got I got the work back. There were other comments, and I'm able to step away from my work and look at it, and my methods were elegant. I was very thoughtful in my methods. But because I was talking about expansion of the Medicaid, it was political. I could acknowledge that it is, that Medicaid is an issue for politics, but it's also an issue for science. Because if we want to change patterns of health, and 38% of our United States population relies on these subsidized programs. They're one-third of the population, and there's gaps in how we serve this group of people that are recipients of these services. How are ever we going to change our healthcare system, right? So maybe it was the topic maybe was political, but it's only political because we make it political. How about if I just made it an issue of health equity? And and that's the lens that that reader came to the paper at, right? So it's
Right.
hard. It's hard. It's hard because
Is
you're gonna be told you're wrong. I don't
is that
know.
that distinction between critical and radical, right? When you're talking about it conceptually versus actually pointing to the systems that exist that are, you can talk about limiting healthcare access versus talking about how healthcare access is limited, right? There's that verb that really changes the whole
Yeah,
concept.
and that's not only change it, but my discussions where it typically in a scientific paper, you go to the discussion, we are repeating what we already found, right? Like this is where my
Mhm.
work sits. I try to be thoughtful when I write a discussion that is like of my own production and say, here's some easy steps. Here's what we could do to move forward in this. Here's some proposed ideas, right? Typically in science, I think that we don't like that it doesn't follow the steps of what a discussion would look like. Not pointing out the problem and how we can fix it. We point out the problem, we say, and then we say other researchers should do this. I like to end my work by saying, here's what we can do as a society, you know? Like,
Right.
why am I leaving my work, my uncoverings to another scientist? Like this is the charge forward, right? So inequalities in healthcare, one of the first articles published of inequalities of health actually inequalities of healthcare, inequalities of education, inequalities of housing. If we think about just inequalities in general in my discipline, which is sociology, right? Um, we're actually like scientifically recorded and I'm going to say the first and use that loosely because I'm sure there's some other work, but um in this book called The Philadelphia Negro by W.E.B. Du Bois, right? And so he writes the conditions of this region in Philadelphia for the Black community. And so they highlight disparities, inequalities of education, work, family dynamics. And so this work was published in 1904, I'm pretty sure. 1904 was the publication year. Oh, I'm sorry, 1889. It was published in 1889. So inequalities are not new. It just didn't
Right.
seep into our data, right? Once we uncovered it, somebody said, ooh, bad stuff. Let's not talk about it. But if we don't talk about it, we're never going to be able to fix it. Yeah. So
Right. And if we
looking at,
keep it in that academic conversational realm and subjugate it to, we're going to talk about it for another 130 years
yeah,
versus these are
yeah,
concrete steps that we need to take.
yeah. And in that book, they actually give some stats. 1889.
Yeah.
It had to reform education. If you read that book, like if you read that chapter just in education, you would be like, we've done nothing of this, but we've known this. We've done nothing to change it, but we know it.
Right.
So
Right.
it's
And so
kind of,
that again is that power dynamic, right? Who's being heard and who can actually change
yeah.
these massive institutions outside of science, these huge political institutions, these huge community needs.
And who gets to decide what's worth discussing?
Yeah.
See, who decides what data is worthy? That's important. What is worthy to uncover and what is worthy of change, of innovation, of advancement. And I said, what is, but the what is always has people in it. Data are people, people's stories, people's lives. Like we talk about data as if it's this thing, but it's not a thing. It's actually people in people's lives. It's connected to people's lives. It's connected to people's lived experiences. It's connected to communities. So data is not just data. You know, people use like, oh, data don't lie. No, data lie. Data lie all the time. Because when you collected data by omission, when you collected data that omitted people, you started with a lie. So how do you expect a lie to turn not to a lie as it unfolds? Typically, when you lie, right? When you're like, just even a white lie actually eventually turns into a bigger white lie. That's what happens. It's the same thing that happens with data. When you collect data that was flawed, that was already a lie, and by lie I mean it wasn't holistic. You didn't consider everybody, or the way that you collected it didn't actually wasn't actually a fair way to collect data, because we've also done that as an institution. Then it was flawed to begin with. You lied to yourself both as a scientist and as a person, because sometimes all you need to do is some common sense to be like, huh, I could have sworn there should be other people. My sample is 80% the same group of people. I wonder why. Like statistically, that's impossible, you know? And so if you started with a lie, and that's what I mean by critical scholar versus a radical scholar, okay?
Mhm.
Critical would mean I am telling you, you gave me flawed data lists. This is wrong. That's critical. But
Mhm.
now I'm saying, Liz, this data's flawed. Let me tell you why. I don't know how to get better data, but I wonder if this other person here can help us. And that person might as well be somebody with lived experience or community knowledge, or just simply the person that we didn't acknowledge when we collected the data. I mean, that makes sense, and so I think that data do lie. I guess I want to tell
Yeah.
you data do lie because data are collected by people and we are flawed and science is flawed, but it doesn't have to be and it's never going to be perfect, but we could do better. In the classroom, students go, well, is there a better way? It's a different way. Because when we look for the better way, we entrap ourselves into the same history of presuming this other way is better, than the other way. And then historically, we're going to be demised by our own process. That we're always looking for the better, right? It's just a different way. It's different. And it leaves us open as an institution for future change because science is supposed to be changing. We are supposed to be changing. We are embracing innovation. But as soon as innovation, change, and science, are criticized, then you're a radical, then you're a critical scholar. That makes sense? Like,
Yeah, absolutely. I'm so stuck on this idea, I guess, of how how do we include everyone? How do we make sure that we're hearing everyone's voices? And is the flip side singling out populations? Is it doing making that effort to do cross-cultural research or identify when it is and isn't and who's left out? Right. I guess I'm
huh.
that's just such an enormous idea that you've introduced. I'm trying to sort it out.
Yeah, yeah. So I'm going to answer in a very non-scientific way.
Okay.
I think as a scientist, you got to go in with a very calm heart, a gentle spirit. I'm gonna say that again. As a scientist, I try to go in with a calm heart and a gentle spirit. I don't know all the answers, but damn it, if my pedigree of scientist did a wrong and it's now in my hands to make it better, then my heart has to be open to doing it. And I said better, but to do it different. But what I mean by better is do it better by considering that maybe by omission of our practice, you know, we did we did harm because science is harmful. So now that is when I will say that there's ways to do it better. And I think because science is said to be objective,
Mhm.
you leave your emotions out of it. I think that's really hard because this is why I say you have to go in with a calm heart and a gentle spirit. Because if you're not upset that the some of the scientific work that has been produced, for example, in the realm of um, women's health care,
Mhm.
to keep women as second-class citizens and lesser than men, and you still think that we can't do better by women, and you're not enraged by some of the atrocities that have been committed to women's bodies by scientists that were men for the sake of science, innovation, and technology. A lot of that history in obstetrics and gynecology. Um, so I think like if you're not it, let that anger, let those emotions feel your passion to lead with a calm heart and a gentle spirit to seek a different way to do things. And I think to me, that is radical thinking in science. Because if I sat in a group of like scientists and was like, so let's put our gentle spirits out here or here, it's too warm, it's too fussy, it's no longer objective. There's a way to be objective, and I think is an objective and still kind and still do quality science, still there is a way. It just requires you to be different, radical, you know?
Right. You reminded me of a paper that I read when I was doing my master's degree about nutrition education interventions
Oh,
in poor expectant women who were pregnant, or poor women who were pregnant.
mhm.
And so much of this paper was going on about how here are the interventions and here's what we tried, and none of their eating habits changed. I was sitting there just screaming, "Did you give them money for food? Have you considered this possibility as an intervention?"
Right, right.
Right? There's just so much that we can navel gaze all we want about. Oh, nutrition education is ineffective, right?
Mhm.
No, that's not the takeaway here.
That wasn't a takeaway. I have a similar example in real life because I am also I've done a lot of my work is applied, right? And it's applied because I can't be left with a simple scientific problem and be like, well, now I know you need food. Great. So in a different role, not as a scientist, um, well, still a scientist, uh, as the wave of post-COVID, um, a lot of our healthcare system, the broader system of healthcare, right, um, spearheaded a lot of equity work in the realm of health, right? And social determinants of health became important because the inequalities of deaths experienced across Black and Brown communities, at least in the United States. I'll speak from that level. So then hospitals and funders, people that fund hospitals to go do research and improve patient outcomes, all started what we do clinical screenings. We started screening people for the needs of social determinants of health. So you see patients so diligently answering a survey. Do you need food? Yes. Do you need transportation to get to the hospital? Yes. Are you housing insecure? Yes. Do you need help finding a job? Yes. And then here comes a nurse to see the patient and they're like, oh, thanks for filling this out. And the patient's like, am I going to get help? I just said yes. And the nurse says, oh no, this is just for the hospital. They're having us collect this without a full explanation of why this person was engaged in this activity, right? This is how our everyday practices, good intended. This was very well intended. We wanted to know how deep was the problem. Well, it depends where you live. But in my neighborhood, all I have to do is go to downtown Orlando to see the problem. Because all I need to do is walk a few blocks and see pregnant women living in tents, small children running around with dirty diapers and no food. Somebody that drank their sadness and their experience on homelessness after serving our country in a war. I didn't need to have our patients collect these data. You just had to acknowledge that every single city, every community has a space where we push people to the as social outcasts and they gather together. We didn't need to ask those questions, but we were doing it for the sake of science. We were doing it to improve people's lives. We were doing it to advocate for people. Okay. At the end of our first quarter, we realized 30% of our patients were in need. We did nothing. How are you okay with that? I, I'm not okay with that. Why did I ask if I couldn't help? It's perplexing to me that somehow we are okay knowing there's a problem and saying, wow, wouldn't it be nice if we could fix it and feel like we can? It just requires us to imagine radical change, reimagine our systems, reimagine what it means to advocate, reimagine what it means to collect different data. It requires our imagination.
Right. And the difference between collecting and knowing that is 30%, 38%, the number that you gave of, the patients who were coming in, were housing insecure and food insecure and everything, the difference between seeing those numbers, the percentage, the absolute numbers, and hearing what, 5 stories, 2 stories, just the difference it would make in understanding of the story those numbers are telling.
Yeah. Not only that, also, I love that. I love that you said that because that's how these two types of data talk to each other, right? But if we now just have that 38%, right? And now we know, but there's no stories, right? It's so easy to judge. It's so
Mhm.
easy to say, well, people are not working hard enough. People should invest in healthier foods. They should take a cooking class. Like that assumes people have the power and the knowledge to do all of that. So we also propose innovative solutions that don't work because we produce solutions without actually having a dialogue, right?
Mhm.
We scientists, we have the answers. We find out the answers and we propose solutions that are supposed to work. And we hope that somebody can implement the solutions. See, because science, we produce the knowledge. We hope that others use our knowledge to make change, right? But if
Mhm.
that was the case, then maybe we should also kind of invest a little bit in making connections across worlds so that somebody can actually implement our findings, do something with them. Productive, something that can, something that can be utilized, I guess, or put in practice. Mhm.
Right. Yeah. Just listening to what's been said and having that power to make those changes would be, yeah. And I love that perspective shift, right? Of applying the science, applying what you're learning, and making sure that in the process of gathering that information, you're not harming people, you're not excluding people, or acknowledging that by necessity there are going to be groups that are not adequately represented, and making that explicit rather than just saying, well, they'll see the numbers, they'll understand that, this 80 sample that's 80% this group, and is obviously not representative, making that so clear to the consumers of the data. That's incredible.
Mhm. We collected our census, every 10 years, right? And the last time we collected the census was, I think, a couple years post-COVID, if I'm not mistaken. I forget when we collected our last census, but um, that census data, there's so much missing information. Um, and I we rely on census data to make so many decisions. It's decisions about how we distribute money, decisions into states, into communities. But just our last results of the census, given the upheaval of our social conditions, right, is flawed. It doesn't take a rocket scientist to know that. It doesn't take a survey expert to know that. It just takes for you to have been this like person navigating the world at the time of the census to know that we actually should probably collect the data again. There's gaps in that data. But we're so attached to this idea that the census is conducted every 10 years because it's presumed that those waves of 10 years, kind of insurge demographic changes that are worth exploring and looking at. But you already know that, and it's like you just need to contextualize the system and the social conditions and where the data was collected to tell you that that data needs to be recollected. It's so simple because now we're going to use these raw data to push forward and on other things that the census relies on, right? Decision making that's already flawed because, it's the context in which it was collected, it was a complex context. There was a lot of collective grief, a lot of collective loss, a lot of uh, collective oppression. I mean, there was a lot going on in the world. And so now we have to wait another 5 years for another census. And we're going to be uprooted from a whole other different social environment into this new census as well. So I think we did think about that. A lot of work that doesn't diminish the work that we've done. And then sometimes I think when we collect data like that, we're like, well, we did the best we could with the situations that we have. And so now we're going to rely on this. That's okay. It's okay in some circumstances, but not, then you should be cautious when you make decisions based off raw data. You should be just as
Right.
cautious, and then say, oh, but remember these data and remind ourselves, but remember these data were flawed because of this. So maybe we should do this. And maybe we should consider that. Yeah, I don't know. It's just an example at a very large level, but I think that's an example of a data that impacts a lot of decisions that we make as a nation.
Right. And that's so important, I think, to sort of bring it to the early childhood level. There is so much that we're seeing in all education, right? I think K-12 gets a lot more of the press, but certainly birth through university needs to be talked about and considered. I wonder, you know, the way to think about new information coming out when we're thinking about how it applies to young children and how that population is by necessity constantly changing, because when you're a young child and a few years later you are not a young child anymore and your information is different, right?
Mm-hmm.
How we can use this, the fluidity, right, and the knowledge of the very specific time bound cultural moment to make those improvements going forward, right?
Yeah, and I'm gonna tell you that so I'm glad that you kind of asked me this question about early education because the census specifically is used to determine the allocation of dollars that goes into programs like Head Start and Title I schools, right? Special education programs, right? Um, so it's vital. I mean, it is vital to early education, right? Um, so and then children under age 5, right? They're going to be most likely unrepresented because of the shifts in population growth in the family. So think about it. We collected data about kids in 2020, right? Was the census. 2020 was the last census. 2030 is the next one. Yep, 2020. 2020 was the last census. We weren't. That's like less than a year post-COVID. We're collecting census data that's about to impact and have long-term consequences for our entire country, but our kids in particular, right?
Mm-hmm.
And all those kids that were born during the pandemic, right? Post 2020, right? Were not counted. They're not there, right? So they're most likely to be underrepresented in the census just by virtue of how the census is collected. Does that make sense?
Yeah.
And so the money allocated, the funding allocated to early education or to programs that are supposed to meet the needs of children 5 and under, or children in general,
Mm-hmm.
is rapidly changing. And so by
Right.
the time we're using these data to fund, it's kind of outdated, if you would.
Right.
It,
If we're
it's
looking at
so,
the data, sometimes it's just, being
oh,
slashed off of a budget,
good,
but
good point. If we're looking
when
at
we're
the
using
data, yeah, yeah.
sound processes.
When we are using the data, yes, so what's worse, using bad data? And I hear that all the time. So, but
Mm-hmm.
what's worse, using flawed data, doing nothing at all? And again, it's either this or this, right? But I'm
Right.
saying like it doesn't have to be A or B. It can be A and B, but that is complicated and it requires us to change an entire system, and that's hard work. And so this is why we need to be open to change because it's hard work. Nobody likes hard work, not even scientists.
Thank you so much for your time. You have completely blown my mind. I went into this kind of expecting one thing, and you have
Oh.
uh, dismantled it in the best way and given me so much to think about. So I really appreciate your time and
Oh,
thank
you're
you so
welcome. Well,
much.
you're welcome. Anytime. Let me know if I can help you with anything else. Always happy to talk about science and data.
Thank you.